My topic is nursing research. Abstract. Now involves nursing practice. Nursing education and nursing research can only be improved when nurses and student nurses have adequate knowledge of both qualitative and quantitative research in nursing. Nursing as Nursing as a profession has one of the characteristics of an ongoing research which is emphasized on improving patients' client care and making impact in healthcare delivery and the society at large. Introduction. Research is an art and science of discovering new information or confirming a hunch. Let me go to the next slide. According to Aghagba CO 2013, within the contents, the purpose of research is to discover answers to meaningful questions through the application of scientific procedure. Qualitative and quantitative research in nursing upon which this study is based is types of research designs. These are strategies that the researcher adopts to develop information that is accurate and interpretable. Qualitative research. Qualitative research is a means which the researcher uses to gain general understanding of a phenomenon through asking of questions and getting a response from the subject. It is directed at the discovery of meanings rather than cause and effect relationship. Qualitative research design involves the use of language concepts and words rather than numbers to represent evidence. Qualitative research aims to gather an in-depth understanding of human behaviors and the reason that governs such behaviors. The qualitative method investigates the why and how of decision making, not just what, where, when. Hence, smaller but focused samples are more often used than large samples. Quantitative research, on the other hand, refers to the systematic empirical investigation of social phenomena via mathematical, statistical, or numerical data, or computational techniques. The objective of quantitative research is to develop and employ mathematical theories and hypotheses pertaining to the phenomenon. More generally, quantitative research is widely used in social science such as psychology, sociology, community health and human development, gender and political sciences. Qualitative data is any data that is numerical form, such as statistics, percentages, etc. In a layman's term, it means a researcher asks a specific narrow question and collects a sample of numerical data from participants to answer the question. Literature review. Qualitative research can mean the analysis of open-ended questions that responses are asked to write on a survey. It also can refer to what is thought of as naturalistic research, a general label for qualitative research method that involves the researcher going to a natural setting, that is, to where the phenomenon studied live. Cohen, 2006, gave the following as example of qualitative research method. Let me go to have the phenomenology, the ethnography, the grand theory. I wouldn't want to go too deep so that I'll be able to finish my work. Historical methods, Let me explain historical method and case study. Historical method examines social phenomena by studying their historical context or their past. It also describes and examines events of the past to understand the present and anticipate potential future events. It formulates ideas, develops research questions, develops an inventory of sources, clarifies validity and reliability of data, and develops research outline to organize investigative process. Case study. This is in-depth description of essential dimensions and process of the phenomenon study. It has to do with direct observation and interaction with the subject. Joseph Aina, 2011, said qualitative research design involves the use of languages, concepts, and words rather than numbers to represent evidence. Key terms used in qualitative research include study participant, informant, researchers, investigators, phenomena, topics, concept, theories, data, that's narrative, descriptive, and pattern of association. However, qualitative studies in nursing tend to produce results that are less easy to. This has to do with the problem of the samples used at the time. For example, that our feelings about waiting can change depend on our particular set of circumstances. Events of even if the researcher encountered the same group of clients on another day, they may find different results. Generally, it is difficult to generalize with qualitative results. Quantitative research, according to Aino, is a type of research design that is directed at the discovery of relationship and cause and effect. When we talk of quantitative, we refer to measurements and analysis of causal relationship between variables at a particular point in time. It must be a value-free inquiry. Key terms used in quantitative research in nursing include subject, study, participant, respondent, researcher, investigator, scientist, concept, constructs, variables, theory, theoretical framework, data, as numeric values and relationship. Langford gave the following examples of quantitative research. One is descriptive studies. A descriptive study is one which information is collected without changing the environment. That is, nothing is manipulated. Sometimes these are referred to as correlation or observational studies. Descriptive studies are usually the best method of collecting information that will demonstrate relationship and describe the world as it exists. Bigman and Robb suggest that descriptive studies can answer questions such as what is or what was. These are studies with the purpose of providing a true picture of a situation as it naturally occurs. They may be used for the purpose of developing theories, identifying problems with current practice, or determining what others in similar situations are doing. No variable is manipulated. Dependent and independent variables are not used within a descriptive design because no attempt is made to establish causality. Exploratory studies, according to Uman, said an exploratory study is undertaken when not much is known about the situation at hand, or no information is available on how similar issues or problems have been solved in the past. In such cases, Extensive preliminary work needs to be done to gain familiarity with the phenomena in the situation and understand what is occurring before a model is developed, and set up a rigorous design for comprehensive investigation. Explanatory studies. This answers the question of why and how something happened. It establishes a cause and effect relationship between two variables. An example might be showing a relationship between the increased presence of police patrol in certain cities versus the reduction of crime. Predictive studies. This is involved with forecasting of a likelihood of something happening. This study usually begins with or leading to finding what will happen. Given that some baseline is already known, this study usually involves some form of human behavior, decision, or condition. For example, if we know that teens in intercity schools aged 13 to 16 are prone to high dropout rate, predictive studies might assess a relationship between the age or gender and not graduating from high school. This is by International Organization of State Researchers Journal. Clinical trials.
You have sorry to interrupt, Helen. You have 2 more minutes. So you have to conclude your session.
Okay. Let me go then. Based on the discussion, the following recommendations are made. Nurses should be encouraged and motivated towards research by providing infrastructures, finance, and supplies to make the process easy. Continuing education programs should be encouraged for nurses to help them broaden their competence and knowledge towards research, as this will make them problem-solving. With this, new technologies and strategies in patient care may be developed. In conclusion, this study gave a detailed explanation of what both qualitative and quantitative research design is all about in nursing. It shows that the need for improving behaviors of qualitative and quantitative research in nursing has implications in clinical practice, administration, education, and research. Understanding what type of research to be research designed to be employed during any study to work competent in problem solving, more efficient, and thus improve the quality of nursing care.